Hello, everybody. Thank you for joining us today for our webinar, The Important Role of Care Partners for Individuals Receiving LSVT LOUD or LSVT BIG. We're very excited to have you all here today, and we also thank everyone on our panel for joining us today. So let me go ahead and get started. Today we have presenters Julia Wood, who's an occupational therapist and one of our LSVT BIG faculty instructors, and then also Jessica Galgano, who is a speech language pathologist and one of our LSVT LOUD faculty instructors. My name is Beth Peterson, and I'm one of the LSVT LOUD faculty instructors and also a speech language pathologist, and I'll be moderating the session here today. For more information on our panelists, we have some biographies in the handout. And we also have some guest panelists here today joining us. We have Gary and Joan joining us from Ireland, and you'll hear from them today. And Gary has gone through both LSVT LOUD and LSVT BIG, and Joan is his care partner. And then we'll hear from Deborah, who's joining us from Philadelphia, and she's the care partner for an LSVT BIG graduate. So for disclosures, we just like to disclose before we get started that non-financial relationships for us as faculty include a preference for LSVT LOUD and LSVT BIG as treatment techniques. Financial relationships include that Dr. Galgano and Ms. Wood are consultants for LSVT Global, and I'm an employee of LSVT Global, and we receive lecture honorarium from LSVT Global. The guest panelists were offered honorarium for this presentation. Just a few logistics here to orient everyone to the webinar. Right now, everyone in the audience, your microphone is automatically muted just to make sure that we don't have background noise from the various environments where you're joining us. But you can still ask questions during the webinar, and you can do that by either typing in a question in the chat box on your webinar control panel, or you can raise your hand and we'll see that you have a question, and then we can unmute your microphone and you can ask your question out loud to the group. And you can always email us. So if you think of a question after the webinar, you can email info@lsvtglobal.com. So it's info as in information. So info@lsvtglobal.com. And I'll put up a slide with that at the end too, so you have that. And for handouts, you should have received an email earlier today that included the handout for the webinar so that you have that for your reference. If you didn't receive that email, there's also a handout. I just put it in the chat box, and so you should be able to get it there. And if you, for some reason, can't get it, you can always email us and we're happy to send you that handout as well. There will be a short survey that will be emailed to you after the webinar, probably sometime tomorrow. If you're able to complete that, we do really appreciate your feedback. It helps us tailor the programs to make sure that they're meeting the needs of our audience members and that we're doing the best that we can for you all. So we appreciate your time in that. It should just take a few minutes. For those in the audience who are looking for continuing education units, after the webinar, you can email webinars@lsvtglobal.com, and we're happy to send you a certificate showing that you participated in the webinar. Again, you'll get a follow-up email and it will include those details so that you'll know to do that in order to receive a certificate. The continuing education certificate, or this activity, I should say, is not ASHA or state registered for CEUs, but you may be able to use it for self-reporting your continuing education activity. We have some learning objectives that we hope you take away from the webinar today. And so everyone in the audience, we hope that at the end of the webinar, you'll be able to recall at least 3 tips from care partners and clinicians to help with treatment of participants during the LSVT programs. We also hope that you'll be able to identify 2 non-motor symptoms that contribute to softer voices and smaller movements in people with Parkinson's. You'll be able to summarize the importance of homework during and after treatment and how care partners can help treatment participants with homework. And then also be able to list resources that are specific to care partners of individuals with Parkinson's disease and other neurological conditions. So I did want to take a moment and just do a poll so we can see who in the audience is joining us. So let me see if I can pull that up. So I'm going to launch it. You should see it on your screen. And if you can just take a minute to click in, if you're a person with Parkinson's, a family member or care partner, physical or occupational therapist or speech language pathologist or other, and then we'll have an idea of who's joining us today. Okay, we'll just do a few more moments, and we have a nice spread. So we have everybody here. So we have individuals with Parkinson's, family members and care partners, and then also both physical and occupational therapists and speech pathologists. So I'll go ahead and close that. Okay. All right. So just very briefly, before we get into talking with our care partners who are joining us, I just wanted to go over the protocols for anyone who may be unfamiliar with them. So the LSVT LOUD and LSVT BIG protocols are based on 30 years of federally funded research and then clinical experience that has also helped shape them. So LSVT LOUD is the speech therapy. It's delivered by speech language pathologists who have gone through an LSVT LOUD training and certification workshop. And LSVT BIG is delivered by either physical or occupational therapists, and it's delivered, and these clinicians have also gone through an LSVT BIG training and certification workshop. So on top of already being the professional, they have also gone through extra training to do the treatments. So just some quick fundamentals for LSVT LOUD and LSVT BIG. They're standardized, again, research-based specific protocols. The target for LSVT BIG is bigness or big movements, and the target for LSVT LOUD is loudness, so a louder voice. So in all with the goal to increase amplitude, whether it's through the movements or the voice. The mode is intensive and high effort, so it's 60-minute individual sessions, 4 sessions per week for 4 weeks. And on top of that, there's daily homework and carryover exercises, and homework continues after treatment concludes. For calibration, there's also what we call a calibration component, and that's to help generalize what you learn in the treatment room to make sure that it walks out the door with you outside of treatment. So we work on, sensory recalibration, internal cueing, making sure you're able to now internally cue and know how big and loud to be, and also helping with those subtle neuropsychological changes that may accompany Parkinson's or some of these other neurological conditions. And we'll get into that a little more in the presentation, so it may make a little more sense as we dig deeper in. But this just gives you an overview of what the protocols look like. So the heart of this webinar here today is really to see how care partners can help during and after LSVT LOUD or LSVT BIG. And so for that, we have some really wonderful guest panelists here. And I'm going to start with Gary and Joan. So just to give you a quick background. So Gary has Parkinson's, and he's joined by his wife, Joan, who is also his care partner, and she's also a speech pathologist. Gary has gone through both LSVT LOUD and LSVT BIG. And so I'm going to just take some time to ask them some questions about their experience with the treatments and Joan's role as a caregiver. And so we'll go ahead and get into those questions now. And let's make sure that you can be seen easily. Okay. Okay, so thanks, Gary and Joan, for joining us here.
Hi.
Hi, it's great to be here.
Good. Well, thanks for being here. And so, Gary, I just wanted to start with you and see if you don't mind telling us a little bit about your history of Parkinson's. So maybe when you were diagnosed, what were some of the first symptoms you noticed, and how you might have noticed those symptoms?
Sure. The first symptoms I noticed came probably about 2 years before I was actually diagnosed. And what I started to notice was things like my arm hanging limp by my side when I'd go for a walk, or when I was brushing my teeth, my hand would freeze and kind of stick to my jaw, and I kind of say, what's going on? Or I was just, kind of walking. It felt there was something catching my leg every time. So I spent, 18 months or 2 years investigating this. And then eventually, 2 years later, I went to see my consultant at 9:30 in the morning one day, and he said, "Oh yeah, you have Parkinson's disease, but don't worry, it won't kill you." And I can tell you, I was absolutely floored. I was 44 at the time. I couldn't believe it. I said to him, with the greatest amount of respect, "I'm 44, I'm not 74. How could I get this condition?" And he said to me, "That's nothing. I had a girl in here last week. She's 29. She has it as well." So didn't get much sympathy from him. Went home to Joan, kind of spilled my kind of story out to her, and just cried like a baby for the rest of the day. And that was a very short version of what it was like. It was very unexpected, completely unexpected, and it took me a long, long time to get to deal with it.
Yeah. Yeah. Well, thank you for sharing that. Joan, did you notice some of those things that Gary's talking about, or did you notice any other signs or symptoms?
Yeah, like I suppose the first thing I would have noticed really with him was, the original problem, which was with his shoulder and just with your hand. And at the time he would have been putting it down to maybe a repetitive strain injury, and there was a whole year of investigations. We went from one consultant to another, and we actually lost count of how many consultants we went to, because they looked at basically everything, because at the time his symptoms weren't very prevalent, and it wasn't immediately evident, and that was clear from the number of consultants we saw. And then began to notice a sort of a dragging of your foot, and that kind of persisted then for a couple of years. Then I suppose, being a speech and language therapist, maybe I was kind of looking out for things like, his voice. To me, he sounded quieter. So that kind of would have been my thing, really, like that I would have probably been a bit of a pain about with you, because maybe even before, you got the diagnosis, I would have been saying to him, you might need to raise your voice a little bit, that he was getting quieter. So I think after the diagnosis, then, like, it was 5 years where you pretty much plateaued. There wasn't much of a change. Apart from maybe your voice, and I think maybe his voice, but maybe that was just me being more aware of it.
That's true.
I'm pretty sure it was actually Joan being very aware of it, because two things that I remember most about that period of time before I kind of started to deal with the Parkinson's were the two things that Joan consistently said to me. She said to me, first of all, you need to deal with this and you need to speak up. And whatever about dealing with it, I used to get kind of cross and say, what do you mean speak up? I'm speaking fine. But little did I know, that I wasn't speaking up as loud as I could be. And that's probably why we're here today.
Well, thank you, Joan, for being such a good support right from the start. So when did you complete LSVT LOUD and LSVT BIG? I guess kind of in relation to that diagnosis and then where we are today.
Yeah, it was actually a long time after. I completed LSVT LOUD in 2015, around about the middle of 2015. And I can tell you from the get-go, it was something that I knew was doing me a world of good. It was literally giving me back my voice. And I didn't know how bad I was until I sat with one of the speech and language therapists from Joan's group. And we had a conversation just like you would over a coffee or whatever. But she had a kind of a speech kind of counter measurer, whatever you call it. And she kind of was writing down the scores as we were chatting. And then at the end of our little conversation, she said, now here are your scores. And I saw like 49 decibels, 50 decibels, 49. So that's pretty good. Yeah, that's good. And then she said, now here are mine. 90, 91, 95, 92. And she wasn't shouting at me. And I kind of went, that's interesting. So the penny started to drop then at that point,
That makes sense. So that was in 2015?
Yes.
And then when did you receive LSVT BIG?
In very early 2017.
Okay. And did you notice changes in your voice or movements after you completed the programs?
Absolutely did, yeah, without a doubt. Probably the voice was the most dramatic, because I've always been, I've always kind of run 2 or 3 times a week. My brother, my best buddy, lives just a couple of blocks around the corner from me here, so we go running a few times a week. So I had lots of exercise, but I had a lot of stiffness and all that kind of stuff as well. So LSVT BIG was great for the exercises that you repeat. They really help. They help you with all kinds of movement every day.
Great.
As does, of course, LSVT LOUD helps you with that, with your voice as well. But I found both of them really impactful in a very positive way. And I am so grateful to have been a beneficiary of the 2 courses.
Well,
and of course to have the number one person to remind me, to do your exercises. That'd be Joan here. Yeah.
That's great. And Joan, did you notice differences in his voice and movements after the treatments?
Yeah, no, I definitely did. And it did have pretty much an immediate impact. And I think a big thing for you know, for me watching it was that, you know, Gary was so invested, and that certainly made a big difference. You looked for a lot of feedback, I suppose, as well, like would have been really, really diligent about doing your exercises every evening. I mean, I can think of several examples of, you know, maybe a couple of years afterwards, being on holidays. And I think of one time we were in Sri Lanka walking along the beach, and Gary did his exercises on the beach. So that's how committed he was. And I think that definitely made it made a big difference, literally. But yeah, no, I think I could see the difference.
Oh, that's great. And how did you help support him when he was receiving the treatments? So, for example, did you help with homework practice or help with cueing or positive encouragement? What kinds of things were you doing?
So honestly, no.
Okay.
That, because when he did LSVT LOUD, I'm a speech and language therapist working in pediatrics, so I work with children. So I wouldn't have had, like, it would have been many years before, like it would have been in college when I would have had previous experience of working with people with Parkinson's.
Okay.
So my information would have been quite outdated. But the speech and language therapist who was working with Gary was a member of my team, and because we have an adult part of the team as well. And I used to check in with her. Okay. So I would ask her, you know, what he was doing and what I could be doing at home. And then I would have checked in with you and just, was there anything I could do? I suppose what I would say, it was a year later, like it was 2016, when I went to London to do the LSVT LOUD training myself, because I wanted to educate myself. I wanted to find out more about it and to see, you know, what I could do. And I found that really interesting. It was really useful for me, I suppose. And then I came away from that and actually I worked with people with Parkinson's using LSVT LOUD. And I suppose what I felt coming from the partner's perspective and just remembering what it was like for me at that time, and feeling that even though, you know, I knew from speaking to my colleague and from speaking to you what I was supposed to do, I still felt I didn't have the kind of insight that I was looking for. So I think when I started doing LSVT LOUD with people, to me, it was really important to include, like I would offer them maybe at the end of the 16 sessions, would you like your partner to come in for a session so we can talk through everything? Because that to me was really important. Like it was fantastic for me. I was in a really lucky position to be, you know, part of a team where, you know, somebody was filling me in on all of that information. And I do think it's hugely important because it's a huge commitment, and I think it really work. You need it, and it's more than the 16 sessions are wonderful, but this is for life. You're supposed to continue doing these, and I see it every day in Gary, because I see he's a walking, talking example of somebody who has embraced every aspect of this and has made a difference. But I think you can't do that on your own. I think it's really important that people are supporting you and helping you to find time to do your exercises and finding ways to remind you. And I suppose the thing that I felt was, I didn't want to be the one badgering him. I didn't want to be the one kind of saying, do I help you now? Or, you know, so I think that bit there, it would be nice to have that negotiated with a therapist in terms of what can I do?
Yeah, that's great. So that's great to think about for clinicians in the audience, making sure you're checking in with the person you're treating, seeing if there's a care partner or family member that you can reach out to see how they can be educated to help at home. What did you find, Gary, to be the most helpful from Joan as a care partner in helping you during treatment and after treatment as well?
Probably during treatment, it was a case of she'd only have to look at me to remind me to do my homework and to be diligent enough. I mean, I'm really happy that she's just said that I'm very diligent. I was just kind of, you know, scared that I had done all my exercises and she wasn't going to kind of chide me over it, you know. But seriously, it was great. If I was stuck with some of the sounds or the like the long loud ah or whatever, she could tell me whether it was loud. She was in the other room. She could hear it. If I was the phrases that I had, it was very good to kind of test them out and have somebody kind of right beside you to kind of, you know, listen to you and give you feedback. So that was really good. And the same then with the LSVT BIG, you know, doing the exercises as regularly as possible, choosing different environments to do them in. Like, well, we don't all have to go to Sri Lanka to kind of do them on the beach, but it helps. But seriously, kind of doing it in in the yard, doing it in the house, doing it when we go away for a weekend or whatever. It's just a nice thing to kind of be reminded that Parkinson's doesn't actually go on holidays, so we should kind of just keep the foot on the pedal there to keep it under control.
That's great. And then having someone walk along with you on that journey sounds like it's
Brilliant.
been a huge, huge impact.
I'm absolutely blessed. It's really, it's wonderful.
Yeah. So you were mentioning when you were talking about when you first saw the speech therapist that you didn't realize that you were talking too softly. So were you concerned at all when you were getting treatment that the voice or the movements that you were doing with your therapist, were you worried that you were being too loud or moving too big?
I was never really worried about being too loud. I mean, what I kind of said to myself was, you know, if I'm shouting in my head, that means I know people can hear me, because that's effectively what I had to do. And because you don't realize, I mean, it's a very strange thing, losing your voice to Parkinson's. But it's like, it's one of the first things that goes. So I don't understand why everybody isn't immediately referred for speech and language therapy on a diagnosis, but that's a conversation for another day. From my perspective, to think that, or to know that my voice was fading, and then to understand that actually I've now recovered it, if you like, is fantastic. Because I've met people who, unfortunately, you know, they're on the same journey as me. We're all heading down the Parkinson's road, but they're probably a little bit behind because they haven't had the conversation about voice therapy and voice exercises, etc. And it does make a difference. And you know what that leads on to. If that isn't kind of dealt with, it makes it very hard to socially interact. And social interaction is so important for people with neurological conditions, but most especially with Parkinson's, because that keeps our brain kind of, you know, on tippy toes and keeps it kind of functioning. So we need to talk, we need to listen, we need to engage, and we need to do it in a way that everybody can hear everybody and have a meaningful conversation. And that's the thing that is so brilliant about LSVT LOUD. That's what it has done for me.
That's wonderful to hear. Yeah. Jonah, kind of along those lines with, he's saying that he didn't really feel too loud or overly big. Did you ever find that his movements were too big or too loud, or did you have to reassure him?
No, I wouldn't have felt they were too big or too loud at all. I don't know that maybe you would have asked me every now and again, you know, did I notice, did it seem very big? Did it seem very loud? Because it is really difficult, you know, from your point of view, just doing that recalibration, just trying to figure it out for yourself. Am I shouting at you? So I certainly wouldn't have thought that you were shouting at me, but to me, you were now talking at the appropriate voice level. And actually, you know, I suppose it made us all think about it, because you know, we could all do with raising our voices, as I've been told myself, every now and again. So it, you know, it is something that, you know, just to be aware of, but absolutely not. No, it wasn't too big and wasn't too loud.
Okay, great. And it's great that he had you as that kind of sounding board so he could figure it out at home too. That's awesome. So do you, Jonah or Gary, do you have any words of wisdom for care partners or individuals with Parkinson's who are in the audience in terms of how you think they can best work as a team during and after receiving LSVT treatments?
I suppose like the biggest thing for me is, I suppose, reiterating what I just said, you know, or what I said earlier, that get involved, be involved from the get-go, you know, try to, you know, absolutely go along to all appointments, you know, try educate yourself, as well as, you know, you were educating yourself, but it's important for partners to educate themselves, just to understand the journey, understand what people are going through, understand how difficult it is to do those exercises all of the time. If possible, I think talk to your speech and language therapist about the possibility of sitting in on some of those sessions, just because I think people can feel, well, I wouldn't know if I was doing it right. Like, am I helping him? Am I hindering? Am I doing it the right way? People might be afraid if they are speaking too loud, you know, it's going to hurt my voice. So to get involved, but also then I think to be part of that negotiation, to, you know, have that conversation around, well, how do you want me to help you? Do you want me to, are there days you want me to stand back because I know I can badger? But there can be, like, is it, you know, how do you want me to cue you? You know, what is it that you'd like me to do? Because it is hard to get that balance between, you know, not being overly involved, but equally not, supporting enough. So I think you need to figure that out between you, rather than maybe one person deciding this is what should happen.
Great. Yeah, that's great words of wisdom. Thank you, Joan. And then, Gary, did you have anything to add there?
I would just like to add that I feel so fortunate that I'm with Joan, and she's my care partner and partner for life. And I've been really, in the context of a really devastating diagnosis, I'm at a point now in my life where I'm probably, ironically, I mean, I'm in pretty good shape physically. I know what to do if my voice is fading and stuff like that. I can do exercises and I can recalibrate myself and get myself up. And that's great. So what I would say is just don't beat yourself up if you don't do your exercises 7 days a week. It's kind of, that you're going to hit a point where you just, because of its very nature, Parkinson's kind of seeps into everything. So your motivation is going to be hit some days, and that's okay. It's not as if you've fallen down the ladder and you're kind of wasted, and it's no good because you haven't kind of done exercise consecutively or whatever. Just take it easy on yourself, but do the exercises as often as you can, and understand that every time you do the exercises, you're adding to your life. You're giving Parkinson's the pushback, and you're in control, not Parkinson's. And I think we can all do that.
Wow. Well, thank you, Gary. Thanks for sharing that. I think that's a really powerful message for everyone in the audience to hear there.
Thank you.
Yeah. So thank you both. We'll move on to our other care partner who's here with us today, but Gary and Joan will stay on, and we'll have some time for questions at the end. If anyone has questions for them, they said they're more than willing to take on any other questions from the audience. Okay, and let me just get Deborah here on the screen. Okay. And Debra, so thank you for joining us as well. And Debra joins us from Philadelphia, and she's a care partner for Terry, who is her cousin. And Terry is an LSVT BIG graduate. Terry has gone through some speech therapy sessions, but has not completed the full LSVT LOUD protocol yet, just because of scheduling difficulties so far, but plans to get it in the near future. So Debra, again, thanks for joining us.
Yes.
And do you mind telling us a little bit about Terry's history with Parkinson's, such as when she was diagnosed, what were her first symptoms that either you or she noticed?
Sure, I'd be happy to. And thanks for having me. My cousin Terry, back in 2017, in April, called me for some help. Her husband actually had Parkinson's, and he was coming home and needed care. And so I came to Philadelphia, and I noticed right away there was something wrong with Terry. I knew my cousin's diagnosis. He had Parkinson's for 11 years at that point. And what I noticed was her slowness in movements, doing laundry. And I thought it was just odd, but I thought maybe she was tired because she's been caring for her husband, for many years. And the other thing I noticed was what she really needed me for was her executive thinking. Terry was trying to settle an estate process for her aunt. She was trying to coordinate her husband's care and just daily living. And she wasn't able to complete the tasks. And that's not like her. She was, an HR person, very, able to handle multiple things. So when she called me for help, that was my first clue. And she was diagnosed in December of 17. And it was devastating for her. I mean, her husband was ill that week. Her husband passed the week of December, of the week she was diagnosed, her husband passed. And so she knows she's seen Parkinson's for 11 years, but I don't think she really thought, she had that. I think she thought she was tired, and even her executive thinking that she was just off because I've been so focused on my husband. And she didn't see herself moving slow. She thought I made it up. I had to actually take a video to show her. She really didn't see it. So that's sort of how her journey started when she was first diagnosed and her symptoms. She's always been a soft-spoken person, a lovely, beautiful, soft-spoken voice. So her voice, I didn't notice, we'll get to that, is later on, a year, about 2 years later is when her voice started getting effective. But at first it was just okay, the voice. And I didn't know much about it, but that's sort of what the initial diagnosis, and it was in 17.
Got it. Okay. And then when did she complete LSVT Big?
She completed it she started in April of 18, and
Okay.
she completed that in June, and she did that really, really well. And so she started that, and it lasted for, it was like a 12 weeks when we really were intense we committed 12 weeks to doing a lot of intense physical therapy, because her gait, and like I said, her slowness is what is why we really heard about this LSVT Big from her first neurologist, and we committed to it from the beginning.
Got it. Okay. And then when did she begin receiving speech therapy?
She started speech therapy in October of 2019.
Okay.
And we just finished, our final was in February of 2021.
Okay.
Like I said, it wasn't the program, so it was, but we finished, and we do all the home exercises now.
Okay. Got it. Good.
Yeah.
And then did you notice changes in her movements after she did LSVT Big?
Yes, absolutely. She was able to, she used to always be able to walk 2 city blocks to go to church, to go with a walk with her dog. And after she was able to do that again, her gait became it was an amazing difference watching her walk, and the movements of her hands doing things. It wasn't so slow motion. She could accomplish more during the day, whether it was her doing her daily living or working on things for her church committees. She was just able to do more.
Yeah, that's great. So it's great that you can really see that impact. Did you notice changes in her voice after she did some of the speech therapy exercises?
Absolutely.
Oh, good.
And how I found out is Terry belonged to a book club and to another physical therapy group at Penn, where she gets her treatment. And one of our friends, we noticed one day he was whispering. And I said, Terry, why is he whispering? I really didn't know speech was affected from 17 to, 2 years later. I just, her voice was fine, And so I asked someone, I said, you notice I can hardly hear him. And that got my attention. I started noticing more. Then as her care partner and cousin in crime, I started noticing that, wow, she is getting softer.
Yeah.
And I convinced her that we should go to speech therapy and do this. And so we also, I got Terry out of her comfort zone by joining a Parkinson singers group. Terry did not want to sing. She's not a singer. But what that also allowed her to see another person who had lost her voice totally. But by singing, she was able to regain her voice. It wasn't for Terry, but she was able to see other examples that work on this. You do have a lower decibel. Like Gary was saying, her measurements were low, and she was able to turn it around and get louder. Yeah.
That's great. Yeah. So great. And just having that awareness too can be so helpful and powerful. So how did you help support Terry when she was doing LSVT Big? I guess kind of both during LSVT Big and after.
Right. For Big, we have a great team at Penn, and they provided us with one tool that was really helpful. It was this DVD. It sounds simple, but besides going to the classes with Terry, and I was at all of her sessions.
Okay.
Because it was going to take that. She was in, a lot of grief initially, when she was diagnosed. So it was sort of like, we have to do it now. We can't wait. So, but this DVD was a great option for Terry, because if, instead of doing it with me in the living room and encouraging her, sometimes I'd put the DVD on and it was someone else doing it with her. So I tried to find different ways to mix it up. But the initial program, any homework she had, we would just do it. And I built it around a routine, not a favorite thing of my cousin's. She's a very organized person, but that was difficult. And I would write out a routine and say, okay, you tell me, instead of me telling her, I'd say, when would you like to do it? And I'd rather do it before lunch instead of after. So then she had more control of when she wanted to do it, instead of just saying, I don't want to do it. So
that's good. Yeah, that is a really good tip. Yeah.
Yep, definitely.
So you're saying the therapist did, so they provided you with the DVD. Did they give you any other type of guidance for things to do at home?
Well, I think a lot of little tools that have helped, besides being super encouraging. I mean, Terry's luckily a very positive person, And, but she had to face a lot all at once. And I said, you know, we have to fight now. You know, Parkinson's isn't going to stop. You know, we have to do it now. And we also got like this little toolkit of these boomerangs off Amazon and try to make it more interactive. But I think the main thing that the therapist told us, that I said to Terry, we're going to do it, and that's why she had success, is you have to commit to the time, especially when you're doing the program, and even after. You have to make it part of your daily life. So you pick it. And then to be encouraging, because Terry doesn't see that she's not big. She really has more of a, you know, she doesn't see it. So they also gave me a tip, and they would do it, and I do it, is we videotape her, and then we show her the video. And that helps Terry register that, oh, I'm not moving very big. So that was another helpful tip.
Oh, that's great. So you kind of have touched on it, because everything you're sharing is really words of wisdom, but do you have any specific words of wisdom for either care partners or individuals with Parkinson's who are in the audience, kind of how they can work as a team during the treatments?
Yeah, definitely. You know, I've always been a good listener, but to try to understand, you know, and listen to Terry and see what, try to connect it with what she enjoys. I think one of the things with her voice that I did is I got this clipboard, and I put her exercises on it for the voice. And I said, Terry, you know, you're already having, you know, breakfast, lunch, dinner, pick a meal and do it after that. So I had her connect it. So it's not always like, oh, I'm enjoying a meal. Maybe I get on a Zoom call with church, and then, oh, I have to go do this. And so I've tried to make it part of, like, you know, something she's already doing. I make it fun by getting her a voice remote for her TV and make her shout out what she wants to watch next. I have her join book clubs that are remote now, but I really try to push Terry to stay involved, stay on the finance and the parish council committees. Don't quit life because you have Parkinson's. You can still do it. You might take longer to get there, but you can get there, and you have a lot to offer. So it's that kind of positive thing, because she feels like she can't do the things she could do before Parkinson's, but you can still do things. So
that's great. Yeah. So it really sounds like you're helping to empower her. Yeah.
Exactly.
Oh, sorry, I didn't mean, I think I keep cutting you off. Go ahead and finish your thought.
No, I was saying about, like, you know, we're saying about being social. The other thing I do for her voice is every week we write down 2 of her friends. She has a beautiful group of friends, lifelong friends from first grade. And Terry's in her 70s, God bless her. And I have her call 2 people a week. I write down the names. She gets on speakerphone, and she stays connected to her friends, because some of them live in, you know, all over. And I use that as a voice. And then they notice, they said, what is she doing? Because she's so much easier to talk to. She's clear, she enunciates. So the voice, the speech therapy was excellent. And Terry has a better relationship with all of her friends since the diagnosis. And then she feels better about herself, and she feels really engaged with life. So
that's great.
That's what I sort of focus on, is things she enjoys. And we're going to travel again. She thought travel was over. She's a big traveler, but, you know, we're going to get there. So.
Oh, that's so great to hear. So then, to just close with you, do you have any other words of wisdom for the clinicians who might be in the audience on how they can best guide or educate care partners?
I think what Joan mentioned is I'm a real hands-on person. So I've been at the sessions with my cousin.
Okay.
And I could see, I've met a lot of other care partners through the group. And I could say that definitely including them, if that's not the relationship someone brings to the table from the beginning, like my cousin and I are attached at the hip most of the time.
Yeah.
Just to reach out to someone in their life. Maybe it's not the person even being the care partner. It could be a friend, you know, to try to involve the more people that know and get involved. But I think including them in the sessions. I think one thing that the clinicians have done a great job for Terry and I is offering us every possible program involved in Philadelphia. We have these flyers out where we go. It could be, there's an art program for people with Parkinson's. That's how we found Parkinson's singers, book clubs, any type of other exercise, taekwondo, boxing groups. The clinicians provided us all this information, what's available around us. And some of it fits for some of us, but it helped us reach out and learn a lot with the Parkinson's singers and other things. So I would say, if you can provide a lot of resources to the partners, then we can work with our loved one and decide, hey, what fits best? And push them a little to try it. Terry would have never tried Parkinson's singers without me. I had to join. They allowed me in. So I joined, and just so Terry could experience it and learn something. And and get better.
Yeah, that's great. I think that's really good advice too.
Yeah.
Well, thank you, Deborah. And again, Deborah is willing to stay on for questions at the end too. So thanks for your time. And
You're welcome.
we'll go ahead and move on to Dr. Galgano is going to discuss a little bit here. So let me just switch. Okay. All right. So go ahead, Dr. Galgano.
Terrific. Thank you, Beth. Deborah, you couldn't have set it up better for me. I think what you were saying, and Joan and Gary, what you were both speaking to as well, and what you so beautifully mentioned in the examples that you provided. We really have to use positive words and experiences. Instead of focusing on what that person is not doing well, if they're not talking loud enough or they're not moving big enough, instead of focusing on those things, we focus instead on what that person is getting right. So we might say, I can hear you. That voice sounds great. You're walking right next to me. Focusing on that positive is so important. And as you both mentioned, we want to help facilitate positive interactions beyond ourselves. And so, if we are the care partner, absolutely reinforcing loud or big movements is important, but also making sure that we set up phone calls, Zoom sessions, those book clubs that Deborah was just speaking about, any in-person get-togethers when possible. And these are wonderful things and wonderful ways that can help people comment on the new and louder voice or that bigger movement. Oops. So we also want to really be empowering to our patient. We want to step back and really let them try something first before we jump in and do it ourselves. I think I'm a care partner myself, and as an intuitive person, you want to jump in, you want to care for that person, you want to do things for them. But it's important to allow that person with Parkinson's to take on roles that they may have stopped doing as a result of Parkinson's. So instead of jumping to answer the phone for them, have them answer those phone calls, write thank you notes or emails, have them help with household chores again, and really start to resume those activities that may have become difficult because their movements were too slow or their voice did get quiet. So you want to stop doing everything for them, even though it might take some more time or it might be more efficient for you to do it yourself. Now, we also want to learn how to be a good coach. And so, as you mentioned, Deborah, it's important to sometimes observe those therapy sessions. Joan, you mentioned it as well. So you can really see and better understand those exercises. Now, that one of the LSVT operating principles is that we want that person with Parkinson's to really empower themselves and to be the boss of their own voice. But it's also very important for our care partners to figure out what we're doing in these LSVT loud therapies so they can be of the best support they can be. So you can learn those exercises yourself if you observe and participate in one of those sessions. In fact, you can ask the clinician to lead a portion of one of the sessions. So the clinician can then provide feedback for you on your ability to model bigger movements or model that louder speech and provide cues as well to your significant other. You might also speak with the clinicians in the middle of the month. Really, I don't know many clinicians who don't speak with their care partners and their patients throughout the course of that month of treatment. But it's important to check in with them so they can give you insight into how that person is doing, the progress that they've made, and ways that you can help them carry over with those things at home. I think one of the most important things is to be patient, really empower that person, be empathetic, because these new habits are going to take time, especially if someone's been living with those smaller movements or a softer voice for some time. So we also want to keep in mind some specific communication tips from our LSVT Loud clinicians. There are many ways we can optimize communication environments for success. So we want to make it easier. This is so hard for that person to keep up loudness and to have that good speech in all of those environments. So let's make those environments more just easier for them to communicate in. So speaking face to face versus moving around and kind of doing something and having your head down at the same time can facilitate your ability to understand them. turning down background noise like lowering the volume or the stereo in the car so you can better hear your loved one, and then choosing seating in a quieter area in crowded environments like restaurants. These are all really great ideas about how to optimize the communication environments for success. And then when we're thinking about movement, you'll want to learn specific cues used by your therapist, by your LSVT big therapist, to facilitate that big lean to stand or taking big steps, and provide cues to move big during these challenging daily exercises or daily activities. For example, reaching big to get into their jacket, into the sleeve of their jacket, or feeling big in their posture. If your loved one is having difficulty, you might ask, how could you do that bigger? And help with suggestions versus, again, focusing on that negative. And I love this last point, discussing the use of secret cues with your partner in privacy for privacy when you're in public. So, for example, if you notice that your loved one reduced or suboptimal posture, instead of telling them to think big or move big, you might agree beforehand to just that you'll put your hand on their back to indicate, okay, I want you to, you're becoming small, let's get bigger in your posture. And you can do similar secret cues for encouraging loudness in group conversations as well. So it's important to arm yourself with knowledge. We know knowledge is power, and it's very important to understand the symptoms in Parkinson's because, as Gary mentioned, it's easy to to know more about and notice the motor disorder, but not really have an understanding or an idea about how the non-motor disorder may affect a person with Parkinson's as well. So, to review, the motor symptoms in Parkinson's are rigidity or that stiffness in movement. You might see a tremor. There might be bradykinesia, that slower movement pattern, or hypokinesia, which is a low amplitude movement pattern, those small underscaled movements that result in quieter, flatter voice, smaller movements like arm swings and gait pattern. And these symptoms will become more severe as Parkinson's progresses. Just keep in mind that it takes a lot of effort on the patient's part to really override these motor symptoms and scale up to normal amplitude movement patterns. But if we only thought about those motor symptoms, we would not be being fair to our patients with and our loved ones with Parkinson's. There are non-motor symptoms as well. Things like depression, loss of higher cognitive functions like a person's ability to internally cue themselves, to get louder or to have bigger movements when they have these lower amplitude movement patterns. There might be sensory changes as well, changes in a person's ability to perceive the changes that are happening, and monitor those movements to be able to move bigger and speak louder within normal limits. And of course, there might be emotional changes as well. Many people can experience anxiety and apathy. And as we know, these feelings can definitely get in the way of function. So let's speak specifically about the sensory disorder, this scaled down output that is so challenging for a person with Parkinson's to really be fully aware of. In terms of posture, your patient may be leaning and falling and not be as aware of the extent to which they're doing that. In terms of gait or walking, patients tend to think that others are walking faster now, and they might not be as aware that Gary was in the beginning of that reduced arm swing. In terms of speech, so many people might deny being reduced in loudness. It's so difficult to figure that out and perceive that. Many times I hear that their loved one is losing their hearing and they might need a hearing aid. And what's so tricky about this is that when people are asked to speak louder, they feel too loud, they feel like they are shouting. And when they're asked to move bigger, those movements feel way too big. So we also want to think about that loss of that a person's ability to internally cue themselves and really think about internally versus externally cued movements. Parkinson's results in the disruption of the internal cue or that trigger to initiate movements. So it becomes so hard for a person to self initiate. They might even notice that they are walking more slowly or they're starting to get stuck. but it's hard for them to shift out of that movement pattern and self-initiate a bigger movement. And this is due to deficits in self-initiated movements, due to underactivation of a very important part of the brain that is involved in motor movements. But what's interesting is that patients can get louder and move bigger with the external cue, with your model, with your cue to move bigger or get louder. So we also want to think of these additional non-motor symptoms that people might be experiencing. There are a range of other non-motor symptoms which can impact one's mood, their ability to think, their ability to process information, and you can imagine how that impacts overall communication and conversation, especially when someone might be moving at the same time, or there are lots of people involved, or distractions going on in the environment. And so you want to think about, if you are a care partner, if your loved one might be experiencing any of these changes in thinking. And what are those changes? Are they having difficulty paying attention? Or do they need more time to think through things than they used to? And how do they do with performing more than one thing at once or multitasking? And do these issues, or outside of these issues, do they ever experience feelings of anxiety, worry, sadness, apathy, or depression? So you can imagine that this is so difficult to deal with. So it's not easy for your person with Parkinson's, but there are a number of things that you can do. And you're doing that right now. You're learning about those sensory deficits and specific to your loved one. And you might then also try to experience what it feels like for you to talk too loud all of the time and feel like you're talking too loud all of the time, or move too big. You know, there's a picture of the Pink Panther here on the side of this slide, and it brings up a funny story that one of the LSVT BIG participants experienced in his exercise during that workshop. You know, if we know, or if you're not familiar with the Pink Panther tends to do this funny walk where he's swinging his arms so very big and taking very over exaggerated big steps. And this person with Parkinson's, when encouraged to do the big movements, called it his Pink Panther walk, because he felt like this normal arm swing felt like he was swinging his arms very extensively. So you can imagine how uncomfortable that feels in the beginning, how unnatural, and how that person is going to need time and practice, encouragement, empowerment, and a lot of positive reinforcement to really start to feel comfortable understanding that these bigger movements and this louder speech is very much within normal limits and is what they want to aim for. So it's important for you to also understand these internal cueing deficits, the difficulty people have initiating big and normally loud movements, because it will help you appreciate the effort that's required to move bigger and talk louder in Parkinson's. So I'm going to pass this lecture over to Julia, and she can start to talk with us about how care partners can also help with homework and how to keep up with these exercises that Deborah, you mentioned, and Gary, you spoke so well about, so perfectly about, that really encourage people to keep up this exercise even after the LSVT therapies have been completed.
Thank you so much, Jessica. And thank you everybody for joining, and all the great tips that we learned earlier from our care partners who are actually the experts here. So definitely in my years of clinical care, looking at that homework routine is so important. And I think a lot of times, like Debbie mentioned, you don't see those changes to executive function, we're not often aware of them. And so we don't realize that helping the person establish that routine, especially if exercise hasn't been part of their day, becomes so important. So we really need to think about, where are they going to do the exercises? When are they going to do them? Chunking it, like Debbie mentioned, with an activity that they're already doing, like a meal, or maybe another activity during the day that they tend to do. And then you also want to help with setup. So, make sure they have the appropriate chair, maybe load the video or the DVD, set up the companion for them, make sure that you've taken away all the barriers that can maybe happen, right, to participation. And then you might need to remind them to do their homework if they tend to forget. And I think even sometimes doing the homework with them, we all need a buddy. And we know from research that when we have someone to do the exercises with, we're more successful. And we want to check in on that homework every day, even writing a note on the form on how you helped, because often when that comes back to us then as clinicians, we can more fine tune, like, oh, they're having trouble with sit to stand, or they're having difficulty doing that floor to ceiling exercise. And that input from the care partner helps us so much in really delivering the best care that we can. And then you also want to ask or observe, what they did in therapy so that you're aware of any progress that they're making. Maybe they were having trouble and you had to help them get their coat on, but now they're having no trouble. And there's a verbal cue that you can give. But then also maybe there's been a setback, a medication change or a change in function. And so we always want to make sure that our expectations are realistic and we're supporting that person in that positive way. Always make sure to cue and coach if appropriate or necessary. And I think that you want to talk with the therapist about how to be the best coach, and also talk with your person with Parkinson's. What do they need from you? Do they need a verbal cue? Do they prefer some of those more private cues, or those physical cues? How can you guys communicate in a way that is most supportive and most positive? And then remember that this homework is going to be lifelong past therapy. You've got to use it. And if they continue to do the exercises, just like, you go to the dentist and you don't stop brushing your teeth after you see the dentist, you continue to do that. And so you've got to do that to maintain those gains. We also want to make sure to help with those follow-up appointments. So when are they going to return for a tune-up? Are there some Loud for Life or Big for Life classes that they could attend, like Debbie was saying, to really connect with the community and find more options for that socialization and then also that practice of their exercise. And we know that, they're really going to be successful through their homework during the treatment and beyond. So it's a daily exercise practice that should be lifelong. We've got a lot of supports, like Debbie mentioned, the homework helper video. We have those for LSVT Big and Loud, and you can download those as well. We have the Big for Life and Loud for Life options that you can look and find in your community. You want to make sure that you have a tune-up. It's that dental model, right? We go back and get that checkup every 6 months or so to make sure that maybe the program needs to be tweaked, or maybe like Debbie mentioned, you need to find some other activities in the community to really help for opportunities to use that loud voice or use those big movements. And it's important to know that some of the postgraduate groups, the Loud for Life and Big for Life, we do have virtual options at LSVT Global that you can inquire and get information about. And so we know that across the pandemic, we've really seen the impact of social isolation on people with neurodegenerative conditions. So that social engagement is so important. And as we all know, when we go to an exercise class, we work a little harder, right? We adhere to the program more. We've got that accountability because now people are like, hey, where were you last week? It really helps impact mood. So that depression and anxiety, that's such a critical part of motivation. We know that that can really be helped with that group interaction. And it also helps improve adherence to the program. So you notice at the bottom, these are quotes from people who have done the LSVT Big for Life and Loud for Life classes. And so I think you can see the impact that it makes not only in their movement and their speech, but also their quality of life. And so how do you find a LSVT Loud or Big clinician? You go to our website at lsvtglobal.com. You can click the Find LSVT Clinicians and select whether you want Big or Loud. You'll put your location in the search bar, and then you even choose the distance. So 10 miles, 20 miles from your home, how far are you willing to go? And then you also can find if the person has a designation. You'll notice there is a Loud for Life or Big for Life provider. And so this can really give you some great information about who's in your area to provide services. And then questions to ask, you want to make sure that their certification is current. Do they deliver the gold standard dosage? And a friend of mine just went through this recently, and it was very frustrating for me as a friend and therapist, because the clinician actually refused to do the functional component task. They would only do the exercises. And they said that my friend would figure it out. Well, if my friend could figure out how to pull up his pants, he would have done it already. And so I was very frustrated. So you want to make sure that you're getting the full program, you're getting that gold standard. And you want to see how many LSVT LOUD and BIG patients has that clinician treated. Because according to this clinician, I don't use it that often, and so didn't feel like they really needed to follow the protocol. What are their outcomes? And then what is the plan for follow-up and maintenance? Because if that person is really using the program appropriately, they'll have that plan in place. And so here's some resources. I know we're at time, so I won't take time to go through these, but you'll notice that with all of these national organizations, there are specific resources that you can reach out to for care partner support and education. So how can you learn more about LOUD and BIG? You can go to our blog, and we have a lot of topics and webinars, articles, seminars that you can attend. And then on our website, we have a patient and family section that has a lot of education, as well as our social media, Facebook, Instagram, Twitter, and LinkedIn accounts. So in summary, our protocols are evidence-based and created specifically for individuals with PD. Care partners are necessary to really help someone optimize their, improvements, ensuring that they're able to take from the clinic what they've learned from that certified clinician into the real world. You really help play a role in ensuring that that success is carried over. The recommendations that are made by that clinician are going to go into everyday life. And it's so important to note that Parkinson's is more than just a motor disorder. You have to understand those non-motor components, like the sensory challenges that Jessica mentioned, where it's so difficult for them to notice if their movements are appropriate. And then you as the care partner can help support those internal cues, those external cues, and really help them continue to move big and speak loud. And so then the homework during and after treatment is critical. Help make sure that they're on track with their homework, that you're giving all the supports that they need to have that continued practice. Use education. Always give that positive reinforcement and love, and lots of verbal encouragement, because we know there's even research on how that impacts the basal ganglia. So the brain responds to that positive reinforcement. And we know, though, when we're sitting here and giving you the pep talk, that caregiving can be exhausting, but also rewarding. So be sure to make time for yourself and recognize that the investment that you're making in your loved one's progress with LSVT LOUD and LSVT BIG will really pay off in the long run in supporting their independence and also their empowerment in their journey with Parkinson's disease. So you can join us next month. We've got practical solutions for receiving LOUD and BIG per the treatment protocol. And also, if you go onto our website, you'll notice we have other events in October that you can attend as well. And so I don't know, we didn't have time for questions, but I'm going to hand it back over to Beth for questions. Thank you all.
All right, thanks, Julia. Thanks everyone for participating. We know we're at the hour, so we don't want to keep anyone beyond if you do need to get off. If you've been on for the full hour, you can sign off now and you'll be able to get the certificate. You can just email webinars@lsvtglobal.com, and we'll email you a certificate of attendance today so that you have that for your records in case you do want to self-report participating today. Now our panelists, so Deborah and Gary and Joan, have said that they'll stay on. They can stay on for about 10 or so minutes to answer questions. So if you do want to stay on, you're certainly welcome to, and we're happy to take those questions. Let me just see if there's any through here. So you can type your question in through the chat box. So if you type a question there, I'll see it, or one of the other panelists will see it, and we can ask your question out loud to the group. And if I change, let me see if I can change the view here. If anyone has a question, they can also raise their hand and I'll see that. But chat might be easiest right now. So if you just type a question in the chat box, then I can, I'll see that, and then I can ask the panelists here. Okay, and I did just send the handout in the chat as well. So if you didn't get that email ahead of time, the handout of the slideshow here today can be found in the chat on your webinar control panel. And then you can always email info@lsvtglobal.com if you need that handout as well. We'll also send you an email. It's within about 24 hours, kind of a summary of the things that I'm mentioning today about the certificate. And then also information on the webinar next month, and then it can include the handout there as well. Oh, and then there's also a quick survey that will come in that email also. So if you can take that survey, we do appreciate your time there. Okay, so this is a question, I guess kind of more directed just to the clinicians. So if we don't have clinicians in our area, can you let us know what online movement resources are available? So Julia, if you're able to take that one.
Sure. So if your loved one has completed the LSVT BIG or LSVT LOUD programs, you can do the BIG for Life or LOUD for Life online through LSVT Global. And you can reach out through info@LSVT Global to get more information on how to join those classes. As far as other, resources, I think that definitely look to your nonprofits. I know the Parkinson's Foundation has Fitness Fridays, and those are recorded and also available online. Davis Finney Foundation has some exercise that you can join virtually. The Brian Grant Foundation as well. I can type some of these in the chat after I mention them. And so these are all ways that you can find, exercise virtually in the comfort of your home. So I think the big point is stay active and, find what you can. Also, sometimes local therapists, or if you have a local nonprofit, like we have the Parkinson's Council in our area, and they have some virtual exercise programs as well. So, or even your movement disorder center, if you have one anywhere near you, they sometimes have online options or virtual programming that you can attend.
Great, thank you, Julia. And this one came in, it could be for Gary and Joan or Deborah. So I don't know if Gary and Joan, if you want to start with it. So as the care partner, Joan, did you ever feel like you got too involved and you didn't want to be, or didn't think you needed to be as involved? Or did it ever feel like you were nagging your loved one? Oh,
yeah, you're grand. Yeah, I suppose, I do feel that's a really important question, and certainly something that I would have felt like in the beginning, because you don't want to be that partner who is nagging all of the time. So I think it is, you have to be very respectful. You have to maybe just check in. I think a lot of what's been said tonight has been really important in terms of being supportive in a very positive way. And I think if you can find that angle, that's definitely a better way to go. And I think the more you find out about it, the easier it is to do that. I think otherwise people maybe sometimes feel like if I'm not always on somebody's case, they're not going to do it, but that isn't the case. I think it is really important that you allow your partner have that autonomy and that they can come to you, if they need that support. I think that's more important. But I suppose just to make it very clear that you are there to help. I suppose with you, Gary, you would have felt very much so in the beginning that this was something that you wanted to take on. I think this was something that you felt a lot of ownership around. So I think, as a partner, sometimes that can be a little bit frustrating too, because, you do want to be part of helping and supporting. So I suppose the biggest thing really is just having very open lines of communication, and chatting it through yourselves.
Yeah, I think you're right. I mean, I think it's important to be on the same page, on the same level, and respect the kind of individual. For me to respect Joan as well. I mean, I know she's trying to help me, so I mean that's really important to understand. Kind of subtle things will happen, and you'll understand each other better the more you kind of are open with each other about what's going on. And don't forget, there will be days when you'll both be frustrated, or one of you will be frustrated, and that's just normal living,
Great. Well, thank you both for sharing that perspective there. Deborah, did you want to chime in?
Well, I just wanted to say, like you said, Gary, the days that you have the frustrating moment, is to, hey, we're still going to do it, but maybe not do it, you know, 10 times. Let's do 5. Like, try to compromise because, Terry would realize, I have to do it to keep moving. And we definitely have a positive relationship, but I was a care partner for my dad for 8 years, and my dad and I had this kind of relationship of a boot camp. It was kind of fun, but Terry's much different. And, she just needs a lot of the positivity, and she could do more than she thinks, and to kind of push her a little without, making it too discouraging for her. But it's just routine. And we finally it took us, Julia knows, it took us a while to get down to like a routine is our friend with Parkinson's. It will help. It improved her life. Just doing it, speech with meals, doing the exercise, then walking the steps inside the condo at a certain time. And without being so regimented, like you said, Joan, it has to happen at 10 o'clock. I sort of have that personality, but I just let it ride for the day. As long as we get it done by, say, 2 o'clock, we're good. And flexibility and always mutual respect and love, why we're doing it. But I think the routine has been our friend, and that was encouraged by our clinicians. That's something that really is helpful.
Deborah, I just want to say, I think you're a cousin in a million. The way you provided support and love and care for the people in your life. I mean, it is just wonderful to hear what you're doing, and thank you for doing it, and try and keep going.
Oh yeah, I will. She's special. We're like her children. She and Peter didn't have children, and my siblings, we've been close for many, many years. So I may be her cousin, but it's just, it's a great journey. And I know we have a lot of fun ahead too. I'm encouraged by what you say about how you travel and things. And I always tell her we can get there. It's just a different way we're going to get there. So that's inspiring. I'll definitely let her know, Gary and Joan.
Oh, thank you. And Julia, there's 2 questions that are kind of similar. If we can wrap up with these, and I'll hand them off to you. So what modifications can be made to the program in situation if somebody has orthopedic problems such as hip replacements or lower back issues, and they may be limited with bending forward or twisting? And kind of the one that goes with it is if someone has limitations with pain, how can they modify some of the exercises in the program?
Thank you. Well, it's important to note that, that is why LSVT BIG and LSVT LOUD are delivered by certified clinicians. And that's something that's different about, especially BIG as an exercise program compared to others. We don't certify fitness professionals. And that's not to say that fitness professionals aren't an important part of your team, but as licensed clinicians for physical and occupational therapists, we understand those orthopedic conditions, how to modify and adapt the program to fit the individual to make it safe and appropriate. So of course, whatever orthopedic issue or restriction, frozen shoulder is very common with Parkinson's disease. And so often the range of motion will be limited. So instead of the person reaching the arm up by their ear, they might have one arm that only can reach to here, and that's as far as they can reach. And that's it, and that's fine. Debbie can speak to also, Terry's had some orthopedic issues within her program that we had to modify and adapt around. And, the exercises can be done in standing, in seated, or in supine, and there's actually benefits to all 3. And so it's finding sometimes the position that works best for the individual and tailoring the modifications and adaptations to the exercises specifically to the need. So that's why it's also not delivered to begin with in a group. It's one-to-one with the therapist, so we can make sure that your needs are met and that the program is appropriate. And then Debbie, did you want to comment at all to some of the modifications that Terry's gone through?
Yeah, what's happened is she had her first left knee replaced February of this year. She's needed knees for about 10 years, and you put things off. But with fighting Parkinson's, I convinced her, along with Julia and a lot of her therapists, that we have to go forward, at 78, and let's do it. You're healthy enough. But it was a big undertaking. So what we did during these knee moments is you can sit down in a chair and do the movements. You can do the big exercises sitting down. And we were trained how to do it, and we continue to do that. So it was really helpful, because I thought if we stopped doing it, she'll go back to that slow moving. And it's my bar is like I started out with, when I saw Terry doing her laundry, how slow. And as we got doing big, when she could do before her knees became a bigger problem, I had her throwing laundry into the dryer. Like all of our jokes been around this dryer and washer, but I can see how she's progressed with it. But she definitely, we keep doing it. She recently has been in and out of the hospital from an odd fall, and we'll be in the ER or we'll be in her hospital room, and we still do big hand flicks. We still do something big because we know Parkinson's is keeping coming. So we find any way. And I've seen her just even being in a hospital for a week or rehab, we still incorporate big because they're focused on her knee. And I said, well, we have to do a little of this, but you can adapt. Absolutely, Julia, the exercises.
I think the most important thing, thank you, Debbie, that was all really helpful, is to remember that big is relative to you. So your big might be different than the other person's big, depending on your range of motion, where you can reach safely, for lower back pains or constraints. So it's not a one size fits all. It is a standardized protocol, but it is something that we adapt to fit the needs of the individual.
Thank you both. Those are both really fantastic answers and very helpful. There was one more question that came through. I know if you need to go, definitely feel free to go, but I thought this one was really good. If anyone, either the panelists or the care partners that we have here, do you have any other suggestions for cueing similar to the one that Jessica mentioned about placing the hand on someone's back for posture? So I think the question is kind of getting at any of those more kind of private cues that Jessica mentioned that they might do with LSVT BIG.
I wanted to share one because it's really fun. When you're in public with your loved one and we're trying to, Terry has an issue with swinging her arms. She stopped doing it all of a sudden. So we would say with arms. I would say to her with arms, she's walking nice, but she wasn't moving her arms at all. So I would be out in public going, no, with arms. And it was, it's kind of embarrassing or whatever. So I came up with the nickname of Wawa, which is a convenience store in Philadelphia. And so I just shout out Wawa, and people think I'm just talking like we're going there. So we make it fun. And I do think we have to be aware as care partners what we're saying in public and how to cue them. But you can come up with like a little acronym that kind of incorporates in your life, and it's fun, and it has her more steady as she's walking. That's my one suggestion.
Great, thank you, Deborah. Julia, it looks like you're going to say something there.
Yeah, I think that, there's a lot you can come up with. One for, volume. I know that I've seen speech therapists do a lot is this, we're kind of here, like raise the volume a little bit. I'm sure Jessica and Beth may have others as well. Sometimes just modeling. So maybe, for posture, you're sitting in a restaurant, start here. You sit up a little straighter, or when you're walking, maybe you exaggerate your arm swing and kind of give them a wink. So I think there's a lot of little things like that you can do where you don't have to, necessarily say, swing your arms bigger or take a bigger step. I was out one night even with a friend, and he, has very small steps. He gets very hypokinetic, and he was off, and we were at Broad Street in Philly, which Debbie knows that you're trying to cross that, and he's freezing and akinetic, and he's a scientist. And so my question was, how many steps do you think it takes to get across Broad Street? And the number he gave me, I was like, oh, come on, there's no way. And so he took off counting his steps, walking as big as he could. And I'm like, yes. So sometimes think about, the background of the person. I knew if I challenged him as a scientist, I'd have him. So little things like that. As a loved one, a lot of times, the buttons, like Gary and Jonah, I bet she knows kind of little things to say to kind of, get him going. And so those sometimes then you're not saying big steps. It's kind of putting the onus on them to think about how to move bigger or be louder.
All right, thank you, Julia. And I think, so that wraps us up here today. I really want to thank everyone for being here. Our guest panelists, thank you so much. Your information, your stories, your experiences are really just invaluable to the audience members we have here today. So we really do thank you for your time and sharing part of your journey with us here today. Thank you to Julia and Jessica for being here as well and giving us all these wonderful tips from the perspective of clinicians. We appreciate you too. And thank you to everyone in the audience. We appreciate your time and glad you're here with us today. We hope that we can see you again on a future webinar. So thank you, everybody. Take care.
Thank you. Bye, everybody.
Bye.
everyone.
Thank you
Thank you.
all.